All right, folks, here's part one, what you've been waiting for. Before I get too far into the topic at hand today, I'd like it if you could like this video, subscribe to the channel, ring the bell, as they say. If you've ever felt pressure to choose between just use the Bible or just trust the science, this series is for you, because those are not your only two options, and the research actually proves it. Let's be honest. In the Christian counseling world, we've basically been offered two caricatures. On one side, biblical or Nouthetic counseling, which says the Bible is sufficient, psychology is dangerous, and all your problems are heart and sin issues. And on the other side, secular clinical counseling, which says religion is private, the brain is all we can measure, and if we can't quantify it, it doesn't belong in the treatment plan. What almost no one explains clearly is that there's a third model, what I'll call Christian clinical counseling. And this is not specific to me. There are whole counseling programs all over the country at Christian universities training students to do this in different ways. So this model refuses to play this either-or game. It's both deeply committed to Scripture and fully committed to evidence-based practice. So in this series, we're going to systematically compare biblical or Nouthetic counseling, secular clinical counseling, Christian counseling, and we're going to evaluate them on 5 big questions. 1, what does each model believe about what it means to be human? 2, what does each model think actually causes emotional and mental suffering? 3, what does each model do in the room? What are the actual interventions? 4, what kind of evidence do we have that those interventions work or don't? And 5, finally, which model is most faithful to the biblical vision of the human person, while also taking seriously what we've learned through rigorous research? That means I'm going to be pretty critical of nostalgic, anti-psychology versions of biblical counseling. And I'm also going to be just as critical of reductionistic, spiritually blind, secular models. But I'm not doing that to score points for my tribe. I'm doing it because I actually believe Christ cares how we treat his people in the counseling room. And that means we have to care about both theology and data. Let's start with the data for a minute. Over the last several decades, thousands of studies have asked a simple question. What is the relationship between religion or spirituality and mental health? Harold Koenig's 2012 review in ISR in Psychiatry looked at over a century of research and concluded that overall higher religious or spiritual involvement is associated with less depression, lower substance abuse, and better well-being. A more recent review by Giancarlo Lucetti and colleagues in 2021 came to a similar conclusion. Across countries and methods, religion and spirituality are most often neutral or beneficial, especially for depression, substance use, and quality of life. So right away, that creates a problem for both extremes. For the secular clinical model, this research means if you consistently ignore or sideline a client's faith, you are ignoring one of the most powerful and empirically supported dimensions of human coping and resilience. For the biblical or Nouthetic counseling, this research means if your model of counseling is so suspicious of psychology that it never looks at the data, then you are ignoring a massive body of evidence about how God's image bearers actually respond to suffering in the real world. In other words, science doesn't rescue secularism and it doesn't destroy faith. It simply describes how human beings, religious and non-religious, actually function. Major psychiatric bodies are starting to admit this. In 2016, the World Psychiatric Association issued a position statement saying that psychiatrists should routinely consider patients' religious and spiritual beliefs as part of assessment and training, because these beliefs significantly influence diagnosis, etiology, and treatment. And on the other client side, Holly Oxhandler's work in 2018 and 2021 shows that the majority of mental health clients in the United States actually want their therapist to be open to discussing their religion or spirituality, and they view that openness as part of what it means to be a good therapist. So the research is already telling us spirituality matters. Clients care about it, and ignoring it is clinically unwise and frankly unethical. But simply saying faith matters doesn't answer the crucial question for Christians. That is, what kind of counseling model can take that faith seriously, honor Scripture, and still use the best evidence-based tools we have? That's what this whole series is about. In the next episodes, we're going to take a hard, honest look at biblical or nouthetic counseling, its real strengths, and its serious theological and clinical weaknesses. Then we'll turn to secular counseling, especially its blind spots for Christian clients. Christian clinical counseling is a model that is more faithful to the Bible and more faithful to the data than either extreme. I'm not interested in straw men. I'm interested in the kind of counseling model that could actually stand in front of a secular research board and in front of a theologically conservative elder board and say, this is faithful and effective. That's where we're headed. In the next video, part 2, we're going to start where many evangelicals start, with biblical or nouthetic counseling. We'll ask, what did it get right? Where did it go off the rails? And is it actually as biblical as it claims to be? Now, before you go, we're going to put part 2 up in the window as soon as it's out. And I would ask you kindly to like this video and subscribe to the channel so you can get the rest of the series and anything else I end up putting out.